Very good afternoon. It's a pretty warm afternoon actually, and I must say that it's a privilege for me and Leena that we have been invited by Sumitra and Ranjan Mitter to this institute, and it's always lovely to be back in school. Last year, I think I was in my alma mater in convent school in Puri, where I did a similar lecture, and today I'm in my son's alma mater. So I think whatever Mr. Mitter just told and Moushami has told in my CV, I think it is overwhelming. I forgot actually that what I am, and it's good that my spouse is today with me. She could also hear a little bit about me. Because it's very difficult for anybody to explain to her what I do for a living. So it's very interesting group I'll be lecturing today. I think we have a lot of students, we have faculties who are young and in the mid ages. It's a difficult group because I think it is very difficult to engage the young and the mid year groups at the same time. But because it's a matter of heart, I think from 5 to 80 or 90, I think it's the same heart, and I think it's the same emotion, it takes the same, and I think it responds to the same stimulus as well. So the question is that are our hearts being cared for? Because I think everybody knows what I'm going to talk about. This is very in public domain today. When you Google something, and everybody in the audience, I think, must have come across patients in their families, friends, who might not have had a heart attack, but might have had a heart problem, or even other things like blood pressure problem, sugar problem, cholesterol problem, and particularly after the COVID pandemic, the cardiac problem, the heart problems has been magnified and amplified, and there are reasons for that. So this kind of interaction with people in the society from different age groups, it should make a difference. And I think professionals like us should not be just only sitting in hospitals and treating patients. It is in our domain that we know we should go out, reach out to the society, not only to the urban society, but also to the rural society, where 80% of our population, they reside in India. So we should not forget anybody, and I think heart attack or heart disease is not an elitist disease anymore. It is in the realm of everybody can have a heart problem today. So let me start my lecture. So as I just mentioned, my audience ranges from children, adolescents, adults, and elderly. So in other disease conditions, if you have a diverse population, the disease process changes, the reasons changes, the manifestations changes, but not so in the heart. Heart is an organ where if it stops ticking for 3 minutes, you are no more. So basically the conditions pertaining to heart problems are similar, if not the same, for any age group. So I think the children would know that this is a vital organ of the body, and it pumps blood to different organs of the body. And we have coronary arteries on the top of the heart, which actually gives the energy to the heart to pump. So as I just mentioned, if it stops for 3 minutes, it's ... So can anybody recognize this picture? If anybody from the audience could recognize this picture? Yes, please. Lady Diana, what's she doing? Yeah, so this is a minefield in Angola, and she was walking on the 5th of January 1997, just a few weeks before she died in the car crash in the same year in August. So this is the magnitude of our problem. So Angola was a country where the mines were laid to such an extent that it used to maim and kill people left, right, and center. And they were usually the innocent population at large. So that's what our heart problem is today. It's like a minefield, and we have to maneuver ourselves between them. So usually it's the number one killer disease globally, and of course in India as well. And about 12 million deaths happen globally. 17.5 million people die each year in India, and 74% of urban Indians are at risk of cardiovascular disease. So the global burden of disease study says that compared to 235 global average death rate per 1,000 population, the Indian death rate is about 272, which is pretty high. And the premature mortality, which means people dying of heart attacks at a young age, is alarmingly increasing by 59% from 1990 to 2010. It is between 23.2 million to 37 million. So that's a huge increase. So the aspects of cardiovascular epidemic in India, there are a few things. When we were independent in 1947, the main problem within us was the communicable diseases like the cholera, dysentery, these kind of things. So these are the infectious diseases was the number one. But now it has gone to the non-communicable disease, which is the heart attacks, brain strokes, etc. The other problem is that we have an early age disease onset in the population. Previously, heart attacks used to be the realms of 40s, 50s, 60s onwards. We see patients today coming to us, we see young individuals who are apparently fit, dying while doing a treadmill or in the gym at ages between 20 and 30 as well. Particularly after the pandemic, this phenomenon has really been an alarming situation. Now, the reversal of socioeconomic gradients means that previously the heart disease was an elitist affair. People who were fat, people who were obese, people who used to be in the high societies, these people used to have the heart problems. Not so anymore. Now there's a reversal of the trend. And there are two situations, because today you see that all the facilities, all the things which we have in urban life is equally available to the rural population and the semi-rural population as well. On top of that, these people that do not have the facility to medical care. So it's a double whammy for them. So they have a heart problem, they have all the bad things required to make a heart disease happen, and on top of that, they do not have the facility or do not have the means to go to a doctor at the correct time. So that is the reversal of the socioeconomic gradients. And lastly is the high death rate. So as an Indian, why should I be worried? Because we are born, as Mr. Mehta just mentioned, that it's a hereditary problem as well. So genetically, we are predisposed to a heart problem. So if an Indian goes to UK and settles there, and 2 generations later, their children and their grandchildren are more predisposed to heart problem compared to an Caucasian. So that is how bad our genes are. It is not only India, it is about the subcontinent we are talking about. So very aggressive heart disease we have, and that is something which we can't get rid of because that is in our genes. And we get it at a younger age. The Caucasians in European countries, they get heart disease at the age of 60, 70 and onwards. We get heart disease at the age of 30, 40. Just besides us, Bangladesh, they get heart disease at the age of 20 even. We have a lot of patients who come to us between 20 and 30 with very aggressive heart problems. So what is heart blockage? On your left hand side, it's a normal heart artery with the normal blood flow, and here you can see the cholesterol plaques coming up. So the myth is that fat deposit starts at an old age, but if you are genetically predisposed to a heart problem, then the plaque accumulation starts as early as 2 years of age. So that's how things are. On top of that, if you have the burgers and the pizzas and whatever, these kind of things on top of that, obviously the fat accumulation will be much more. So from first decade, from third decade, from fourth decade, that's what happens when by the time you are 40, the artery is completely narrowed. Can I just tap that thing? Just give it a tap. So it's not only the heart which is affected. Heart has arteries, so does brain, so does your legs, your hands. So these are also the arteries which are also affected once your heart is affected. So if you have a blockage in your arteries supplying the heart, it is very obvious that your brain arteries are also not normal. Neither are your arteries supplying your legs and your arms. So it is a manifestation of a very big kind of a problem inside your body. So the risk factors for heart disease, the non-modifiable ones, which means things which you are kind of born with or inherited. You have high cholesterol level, family history of heart disease, high blood pressure and diabetes. You can actually have this disease as a hereditary disease. If your parents have these, the likelihood of you getting them are also pretty high. So the modifiable ones means things which you have started is smoking, overweight and lack of physical activity. There are more than that, but we will discuss that later. So these are the non-modifiable and the modifiable ones. So what increases the risk, which you can't help, is the age. It is not within the gender, the race and the family history is not within your control, but things like cholesterol, smoking, blood pressure, diabetes. Smoking can be completely omitted. Cholesterol, blood pressure and diabetes and obesity can be controlled, and alcohol and physical activities also, inactivity is also under your control. So as I just mentioned, the genetic predisposition of Indians, poor handling of fats and metabolic syndrome, and urbanization and sudden increase in lifestyle. That is something which we have seen very often. People coming from the rural background, when they come to in our domain, if they come to the medical college, suddenly they're exposed to city life. And that sudden exposure to city life makes them go a mile ahead of people compared to other people who have actually experienced the city life from the childhood. So they just indulge themselves freely, and suddenly they actually have problems with alcohol, with smoking, and other things which actually can have a problem with the heart, make the heart go weary, maybe after 10 years' time. So you have the bad cholesterol and the good cholesterol. The LDL is the bad cholesterol and the HDL is the good cholesterol. And people who are obese have 2 to 6 times the risk of developing heart disease. So you have all the things I love, these things, and continued on the reverse. So these are the things which can contribute to obesity. Physical inactivity, every morning my brain tells me to exercise and my body laughs the idea. So this must be a thing which is definitely a very common phenomena, and I'm included in that category as well because I don't get up early in the morning. So, but you have to make it up. If you can't do things in the morning, you make sure that by the end of the day, when you go to bed, you have had your exercise and your activities to the optimum level. Cigarette smoking, it causes a lot of problems, increases blood pressure, increases heart attack. These are things which we all know. Diabetes and hypertension, diabetic persons have a 2 to 3 times more higher risk of heart attack or stroke, and 80% of diabetics die from heart. These are all figures and facts and figures which is readily available in the Google. These are not things which needs to be emphasized and overemphasized. We all know about this. This is something which we all maybe don't know or we don't recognize too much. It is a very under-recognized, and it is actually not a risk factor which is there in the books yet. So it's a huge risk factor according to me, because stress is something which needs to be dwelled on, and it needs to be discussed, it needs to be talked on, and it should be a part of the curriculum, how to deal with stress. Children should know how to deal with stress. Then only when they grow up to be adults, they can actually deal with stress. Otherwise, suddenly they are in the big ocean of life and they don't know how to deal with stress. We see a lot of people, young people, who have been very overly protected at home, and when they go to the hostel and when they go out of the home, they feel a lot of stress. So I think stress is something which is always is there. The only person without stress is a dead person. So the only thing which we tell that how to handle stress. So stress can be positive stress, it can be negative stress. During an exams, which the stress which you have is a positive stress that actually makes you perform better. Like when we go out to bat in a cricket match, we have butterflies in our stomach. You must have heard people saying that is a positive stress, and that helps your performance, that augments your performance. Negative stress are emotions which causes depression, anxiety, lack of sleep, and that can cause serious heart problems. So this is a topic which is very close to my heart, which I want to discuss in detail with a lot of forums. And I think the counselors of today, the psychologists of today, they should actually be more proactive when they're discussing stress. It should not be that somebody has fallen sick and then the psychologist and the counselor is being looked into. I think this should be a part of a curriculum. It should be a part of a class, that you should have this much kind of hours per week or per month where you are talking about how to deal with stress. Unfortunately, it is not a measurable parameter. Like blood pressure, like cholesterol, like sugar, which is a measurable parameters. It can be done with a blood test. We have ECG, echocardiograms. Those are measurable parameters. But stress, you cannot measure, unfortunately. But you can feel it's a palpable parameter, but it's not measurable. And sleep is something which is also very important. We know that our great poet Rabindranath Tagore didn't sleep too much. There are a lot of geniuses who slept 2 to 3 hours a day, but we are not them, so let us sleep. So I think 6 to 8 hours of sleep is very important, and sleeping at night is more important than sleeping at day. You cannot make up the night sleep with the day sleep. What you see is the NREM and REM sleep is non-rapid eye movement sleep versus the rapid eye movement sleep. So NREM is deep sleep and REM is a light sleep. So what happens during the sleep at night is that our body hormones get out and they do the reparative work in our body. It's a repair time. So if people who do night duties very often, they have problems because the daytime sleep can never be countered with if you don't sleep at night. A lot of people are insomniacs, they can't sleep. Stress can cause that as well, worries can cause that as well, and I'll come to some other points as well regarding the sleep. So what are the symptoms of heart disease? You can have no symptoms for a very long time. That is when the plaque is building up, as I showed in the picture, you can have no symptoms at all. So this is something which is very worrying as an individual, that how do I know that I have a heart problem or not? You can also have chest pain for a short period on exertion while you're walking, climbing steps. If you have chest pain, that can be an early signal. And if you have a heart problem and that is a complete heart attack, that's something. And then sudden death is something that you've heard sometimes, that some people have not woken up from sleep. Now, the facts and figures about the death in heart attack is that 90% of the heart attacks globally don't make it to the hospital. So all the patients we see, all the treatments we do, all the heart patients we're talking about is only 10% of the population. So a lot of people, they die during sleep, because heart attacks can happen mostly at night time, because there are some hormones which come out which can precipitate heart attacks. And we being in West Bengal, I think our main issue is whenever we have a chest discomfort in the night, it is gas. So, and the first treatment is or Joanna, whatever, these kind of things, antacids, because we don't like to believe that we have a heart problem. And then we go to sleep, and a lot of people, they don't wake up. So we will discuss what are the methods on how to prevent that. Now, women and heart disease is something which is also very under-recognized and under-talked subject. 1/3 of female deaths is because of heart disease, the other being the cancer. And women with heart attacks have a high propensity for complications compared to the male population. And women are roughly 10 years older than men when they present and have more comorbidities, which means they have other complications as well. And young women also can develop heart disease and have a worse prognosis than men. So what it means is that women, when they have a heart problem, they have a worse prognosis, which means the outcome is not so good. The reasons being that they wait longer compared to males presenting to the doctor. Social factors and other factors contribute to that. Particularly in the rural population, I've seen the women, they do not come to a doctor unless they are in their last stage of a heart problem. And then it is very difficult to actually save these people. As you have all heard, the golden hour period for a heart attack. The golden hour period is the time between the heart attack and the doctor intervening. That 1 hour is the most important time, and people actually die. So that is the time when patients or people should present to the doctor. But that is impractical all across the world. So the best thing is that if you have a problem, try to consult a doctor. So presentations in women, only chest pain is absent in 43%, which is nearly half. You can have shortness of breath, you can have weakness, fatigue, and generalized fatigue, which is inappropriate for the time. Somebody who is relaxed and everything but having a continuous fatigue for a long time, they may have a heart problem. And sleep disturbances and shortness of breath. So 71% can present with fatigue, so generalized fatigue in women. So prevention is better than cure, and that is why is that? That is because there is no complete cure to heart attack. It's just imagine a house is on fire, and when the fireman arrives, he douses the fire with the water and then allows the people to go inside and collect some of the things which is left behind. This is exactly what a doctor does when the heart attack happens. The house is on fire, we are the firemen who go in, and then whatever is left, that is for you to actually carry on for the rest of your life. So suppose you have a heart attack at the age of 30 or 40, for the next 30 or 40 years, you are actually left with a complicated organ which is not functioning very well. That is how important it is. Heart blockages and heart attacks are not the same. Heart attack is an eventuality, heart blockages is the process. So heart blockages will eventually lead to a heart attack. So if patients come to us who have heart blockages, that can be controlled, that can be treated, and you can go back to a normal life. But if you have a heart attack, full-blown heart attack, then what we do is actually firefighting and then whatever is left of that. So quality of life is never as before. And obviously it's a very expensive treatment, though in today's world a lot of things are covered with insurance. So eating is something which is very important. So there are two things which happens. One is the intake and one is the output. So what you eat is something which you need to know. And doctors are the worst prescribers of food. I think they do not understand what is food. It's a specialty on its own. Nutrition, they are called. They are not dietitians, they are nutritionists. And we have nutritionists at every level. Again, that is something which every academic institution should have. So I'm talking about a psychologist, a counselor, and now we're talking about a nutritionist. So nutritionist is a very important, because what you eat when you are young is something which will have a legacy when you are actually in your middle age. So if you eat well when you are in your 40s and 50s, it's too late. It's too late. And all the fancy things which we eat when we are in the 40s and 50s, when we have cash in our pocket, we go to expensive shops and buy the expensive things, but your damage has already been done. If you already have 40-50% blockage, at that point of time, if you start eating well, healthy, maybe it's too late. So start young, that's the message. And I'm glad that a lot of young students are here today. Level of activity is very important, because that increases the HDL, the good cholesterol, and lowers the bad cholesterol. So we talk about moderate to physical activity, 30 to 45 minutes on most days. 5 days a week should be enough. And I think that is something which you have to need to do. As I mentioned, the intake is the food and the output is your exercise. If these two are done well from a young age, even if you are an Indian, I think even if you are genetically predisposed, there's a good chance that you can actually remain healthy. So, how many of you have treadmills at home? I think few people do have, but what I've heard is it's inaugurated in a grand fashion when the treadmill comes, and after a month, I think the best place for hanging the clothes is the treadmill machine. So I think it is better that you have a good pair of walking shoes and walk. If you can swim, that's the best exercise. Otherwise, brisk walking is good. But if you go to I think there are some people who will just be antagonized by what I just going to say. If you go to the lake in the morning and then you're walking in a group, so you will not know exactly at what speed are you walking and what calorie you are burning. If you walk 5 kilometers, 10 kilometers in 2 hours, it's not going to work. You have to walk 1 kilometer at a high speed. You have to burn the calories. And then, if you are again in lake, the next destination is, what is the shop's name? Maharaja. So they make delicious kachoris and jalebis. So that is the next destination. So this is reality. This is reality. So that's not going to work. That only you will burn your petrol, maybe going to the lake, and then you chit chat and you come back with a lot of calories back. So it's not only zero, it's actually negative. So just walk and walk alone. Put headphones. Listen to music while you're walking. You don't need to have a companion while you're walking, because that's the exercise you're doing. You don't take medicines along with other people, you take your own medicine. So this is just like medicine. So this is about stopping smoking. This is something which you should never do. Don't start so that you need to stop. So these are some numbers: cholesterol, LDL below 75, triglycerides below 150, blood pressure 120, 80, blood sugars less than 100, fasting post PPS 140. So options, you have got medicinal and non-medicinal. So non-medicinal is lifestyle management, as I just mentioned: diet, exercise, good habits, and positive emotions. And do simple things: eat healthy, walk regularly, watch your weight. Weight is something which is not, you shouldn't just not measure your kilograms. I think we are in a stage of life now where you should calculate your BMI, the body mass index. Go to your phone, calculate to your Google, just type BMI. You have to put in the weight, your height, and your age, your gender, and put in the weight, and you'll see what your BMI is. If it is 25, between 22 and 25, you're doing great. The moment it goes above 25, the alarm bell rings. If you're 30, you have serious problem. If you're 35, God can only save you. So measure the BMI rather than the weight. So de-stress and sleep. I say this is my time. Everybody should have, I think, at least 2 hours a day, where you can do your own stuff which you like, your passions, not opening a laptop and getting back to work from home after working from office. This is your time when you want to do whatever you want, watching a film, doing whatever you like, passion, enjoying your music, doing some paintings, whatever. Early dinner is something which I always advocate, and we try to finish our dinner by, the English people, they have their dinner at 7, but that's too early for us. I think 8:30, 9:30 should be enough. The reason is, you don't go to bed after dinner. That is something which can cause a heart problem. So what we suggest is that you have your dinner, stay awake for at least an hour and a half, let the food settle down, then you go to bed. That will not cause you that acidity problem which a lot of people have, because that can cause a reflux if you go to bed immediately after dinner. Try to have a light dinner, a heavy breakfast, manageable lunch, something in between in the evening, and a light dinner, and dinner over by 9:30. I was very careful of writing this thing, restrict screen time, because mobile screens allows your brain to be active. It takes 2 hours after you turn off your mobile screen for your brain to sleep. So if you turn off the screen at 11, the brain will be actually going to sleep at around 1 o'clock. It takes 120 minutes. But you can listen to music, you can listen to audio, that is not going to hamper you. But the screen itself causes your brain to be active. A lot of times I have experienced that, the music is on and I'm going on to sleep. So that can happen. So clear relationship also exists between physical activity, health, and emotional well-being. And positive emotions like happiness decreases heart problems, and anger, depression, and anxiety can increase heart problems. So medicines are, you have medical pills, you have got angioplasty, and you have got bypass surgery. These are the 3 modalities of treatment we have. We don't have anything else. And why talk to you? Because you are impressionable minds, I believe. This is a good template to start off with, and probably the minds are unbiased and uncluttered as far as the heart is concerned, not about other things. So tip to the young, the nose: no to smoking, no to drugs, no to sedentary life and unhealthy lifestyle. So I've written control and control in the other 2. I have not asked you to stop. It's a control and control. Yes, studies, absolutely yes. Uneducated people have no part in life actually. people who have been what they are today, the big shots of life, who were uneducated, those era and that decades have gone. Now even the filmmakers today who come to me, a lot of them are very, very educated. We have a lot of cricketers who have been engineers, and so education is something which not only gives you degrees, but it gives you the confidence in whatever you do. So I think it is very important that you study well, and while you can study, complete your studies completely. If you even get into your work experience and everything else, try to finish your studies completely. It is very difficult to start studying again after you start working, because there's too much of allurement happening across the world. So put your head down, finish your studies, then start your life. Food, friends and family, enjoy, be passionate. And how institutions can help, as I just mentioned, curriculum, your canteen food and hostel food, sports, cultural activity, faculty as role model. So Future Foundation School actually ticks all the boxes. And thanks to Mr. Ranjan and Ms. Sumitra for actually taking this forward. And this is something which I have not discussed with them ever. I found that these are the things which is already in this school. And I meet a lot of students from different schools. I don't see all the boxes ticked. If you have studies, they don't have sports, they don't have grounds, they don't have sports, but you have a fantastic facility coming up in Baripur. Your cultural activity is very strong. It's extraordinarily strong. I was just seeing the marks which was posted outside in the campus. So fantastic marks. Congratulations to all of you. And your faculties are obviously role models. So try to surpass them, not be like them. So this is something which is a little heavy. So we need Government of India and global bodies across the world need to formulate and implement some policies which is evidence-based, and prevention, early detection, treatment with the use of both conventional and innovative techniques. The innovation is very important. It's not a same size fitting, all. You have to make your size of your coat which will fit you. So what happens is correct in India will not be correct in UK. That thing will not be correct in US. So policies has to be different. You can have a framework, but individual policies has to be different, and it has to be formulated by educated people, not by people who do not know anything about health. So these are the two mantras about prevention: awareness and control. Sachetan, Niyantran. It is not about no. It is about Sachetan and Niyantran. So Sachetan is intelligence, that's IQ, and control is EQ. If you have both of this, we can have all the good things of what Bengal provides, particularly in the cuisine which we have. We were just crossing Ranikuti Mode when we saw Lina just told me about the Rotan biryani, which I think a lot of people, including my son, who used to have that. So once in a while you can have all of that. We do actually all love our food. So we cannot tell our patients not to have a life of hermit. That's not required also. But awareness and control, you can have everything in life. But if you have a heart attack, then it will be a ton of bricks falling on your head because everything is stopped. So it is in your betterment that you do not actually fall in a trap of a heart attack. So heart disease is avoidable, that's very important. Following a healthy lifestyle doesn't have to be complicated, and it doesn't mean you need to live a life of self-deprivation. Instead, find ways to incorporate heart healthy habits into your lifestyle, and you may well enjoy a healthier life for years to come. So this is in one of the European cities where students and elders of all age groups are going to work in the bicycle. So the carbon emission is zero, and everybody is exercising. And this is my alma mater. At the age of, I think it was 50 years of our get-together of our nursery students. So we played a cricket match with the current class 12 students, and this is in Puri. And so this is me, and this is the cup, and this is with the students, and this is the same room where 50 years ago we sat, and our principal used to give chocolates after the results are out. Thank you. So we want some questions now for about 10-15 minutes. So, yeah.
Good afternoon, sir. May I ask you one question which has been haunting me because when a few years back I went for a checkup, and at that point of time it was diagnosed that my right bunch is blocked. So I became a little bitter, but my doctor said it's okay. Most of the people have it. If it is left bunch, then you have to be cautious. So is it so, sir? What should I be doing?
Yeah, I think you are very blessed, I would say, with the right bundle branch block, because Mother Teresa actually had right bundle branch block. So you are one of the few elites who actually have the right bundle branch block, but it is a normal phenomenon. As your doctor has rightly pointed out, it is not very abnormal. Millions of people have right bundle branch block and they live a healthy life. So not to worry. Yeah.
Good afternoon, sir.
Good afternoon.
So the question I have is the people or the patients that have heart attacks, do they have any kinds of skin symptoms such as bad breath or something like that? Because, sir, a person that does not have a heart attack, their body should not be producing any kind of secretions that will give out bad breath or smell. So can we diagnose a patient with heart attack or a disease of any kind of such that have bad breath or smell?
Yeah, okay, it's a good question. Bad breath actually happens 90% of the time. Sit down. If you have a mouth problem, oral problem, so it's a local problem which can cause bad breath. So it's the exit point basically. And if you go to the entry point, you can have bad breath because of a lung problem. You can have bad breath because of your gastric problems. But heart, no, it doesn't emit bad breath.
A very good afternoon, sir. First of all, I'm so glad that I have the opportunity to talk to someone like you, because I aspire to become a doctor, and in the field of cardiology itself. So it's inevitable. It's like evident that in every field, like there's stress in every field. It's not it doesn't depend on which field you're working at. So, like in the field of cardiology, if you're a doctor, there will be stress. So, and it's something I want to do, and there will be stress. So, how would I deal with it? Because that's something I would like to do. At the same time, it would have side effects. So, how do you deal with it?
Yeah, cardiology doesn't have any side effects, I can tell you that.
Stress.
Yeah, the stress is not a side effect. Stress is something which is always there. You, as I just mentioned, that you will perform well when you actually have a positive stress. So, I think I'm very glad that I found a cardiologist amongst us who will track you, I think, through your school, what you have become at the end of 5 years, 6 years after from here. So, but yeah, to deal with stress, I think you need to be passionate about what you're doing. If you're passionate about something, that should not stress you. People who are passionate about the sports, stress doesn't happen in that sports. It can happen in other realms of life, but that should not happen in sport. If you do not like something and you are forced to do that, that causes stress. So I think students of this generation, they are blessed because they don't have to, they are not imposed on that this is what you have to become. At our point of life, our colleagues, my batchmates, a lot of them have become doctors because their parents wanted them to become doctors. Their parents are not doctors. I see a lot of budding cricketers. Their parents want them to become cricketers. That's why they have come to playing cricket. That is a lot of stress. So if you love what you do, I don't think that should stress you. And whatever stress you get, I think that's positive stress. And beyond that, I think there is, just enjoy what you're doing. And it is not that you have to be a cardiologist. If some point of time you feel that, when you're doing medicine, something else is attracting you. So just go to that branch. You don't need to come to branch which you have thought many, many years ago. Okay?
And the last thing is like there are some other things that act as a stimulus to stress. Like, for example, if someone is very busy with their professional lives, being a doctor and like whatever, they give less and less time to their families, and this is something that breaks the family apart. So this can be a cause of depression or stress. So
don't do that. Either don't have a family or you do cardiology. You have touched a very raw nerve, I'll tell you that. So, I think I'll just give you one tip for cardiology, that here the decision making is very, very important, and you have to make the decision very quickly. You've got 3 minutes for your heart to stop and patient to die. So the judgment call is very important. You cannot sit on a cardiac patient. You have to make a call. Right or wrong, the call has to be made. And with experience, you'll be making more and more right calls. And the best thing about training abroad is that it is a very supervised training. They are not leaving a young cardiologist with a lot of patients. It will be supervised. So the more you do the right things of life, more times, you will actually do it correctly. I come across young cardiologists who comes and tell me, sir, I have done 1,000 operations. So I ask them, I want to know whether you have done the operations correctly or not. Because if you have done 1,000 operations wrongly, you become the master of the wrong. So it is very important that a decision has to be taken, and the correct decision has to be taken, and it has to be taken very quickly. That's a cardiologist's call. Yeah. Can you turn off the light? I don't need the light.
Good afternoon, sir.
Yeah.
Right or wrong, the calf muscle is called your second heart. How does it help you in an emergency?
Which one?
Your calf muscle, the calf
muscle.
So how does that help in an emergency?
I think running towards the patient.
So the calf muscle, they say that it has the blood.
You can run towards the patient because it's an emergency. That's what I'm trying to say.
Okay, thank you.
What is she? That is what I'm trying to say, because in an emergency the doctor has to use the calf muscle. Yeah.
Sir, first of all, good afternoon. Sir, in your presentation you spoke about sleep routine, and we should have a good sleep routine. Sir, I would like to point out that people of our generation and upcoming generation, they think that having a bad sleep routine is something very cool, and sleeping at 2 o'clock, 3 o'clock is something very nice. Sir, can you just please elaborate on this and how to have a good sleep routine?
I think 99% people don't have good sleep routines, because otherwise if everybody slept well, we'll be out of business. So that saying, I think, your early dinner is a good stimulus for a good sleep. A heavy stomach is not good for sleeping, because when you're lying down, the whole content of your stomach tries to move backwards. So that is very important. Sometimes some people tell that some warm milk before sleep is good, but that is not very evidence based. But I think if you're relaxed, if you're tired, you should sleep well. If you're worried, sleep getting is a problem. So, but early dinner, I think, and getting to bed and switching off your mobile screen at least 2 hours before sleep, that should help. But saying that, I think, you rightly pointed out, I think the sleep problem and the stress problem is actually the biggest issue in the heart problems we are seeing in today's world.
Yes, first of all, I would like to thank you, Dr. Dev, for this enriching presentation. So I have two questions. The first one is, what should be the ideal blood pressure at the age of 50? This is my first question. And my second question is, it's particularly about me. I've always seen that my resting heart rate is very low. It's around 65, 66. So is it something to be worried about, or it's okay?
Yeah, I think if your resting heart rate is low, and if you do not have a few medical conditions, that's okay. Like thyroid can cause a resting heart rate to be low. Otherwise, it's a blessing to have a heart rate which is a little low. Bjorn Borg, I think, was a very good tennis player. His heart rate was 32 or 34. So it's like a efficient heart. The lower your heart rate, more efficiency you have in your heart. But you have to make sure that there is no other medical condition or any medicines which is causing the heart rate to come down. But 55 is absolutely okay. What was the first question?
What is the ideal blood pressure?
Ideal blood pressure. Blood pressure will vary from age to age. Normal blood pressure is 120/80, that's what we tell. But as our age progresses, our arteries harden. So the blood pressure, it is natural for the blood pressure to go up. So we do not say that it's a normal blood pressure for everybody. It's not something which we say for everybody. So every age group has a different blood pressure.
So
which
at
is
50s?
50s, I think even 130, 70 is a kind of, the lower blood pressure is something which you are more worried about, the diastolic blood pressure. So that we try to keep between 70 and 80. We are more worried about the lower blood pressure. Unless the upper blood pressure, which is systolic blood pressure, it goes above 150.
Thank you, sir.
Good afternoon, sir. My question is that in a hot afternoon, summer afternoon, after a brisk walk, if we have palpitation, is it a sign of heart problem?
No, why do you have to walk in the sun, in a brisk?
No, sometimes you have to move about, and after that, if you experience heart palpitation.
No. I think palpitation is actually not the same as a heart problem. Palpitation is what we feel. Sometimes you can have a heart rate of 70 and you can still feel the heart. So that sometimes people say as palpitation. So, but medically, palpitation is something which is a high heart rate, and high heart rate in a warm afternoon is normal. But it must not be that you are sitting in an air-conditioned chamber and your heart rate is very high. So that is a very appropriate response of the heart.
Okay, thank you.
Good afternoon, sir. Just now you spoke about the BMI. I calculated my one. It is coming 28. So actually I joined the gym because of the overweight condition. Now the thing is that, sir, how can I understand? Because a few days before we heard that many actors died in the gym and all. So is there any test? Means that will be helping us to say that yes, I am capable of doing the gym and all. So is there any test to join before joining the gym? I can test for myself.
See, when we talk about exercise, we are talking about, sit down, we are talking about aerobic exercises. Aerobic exercise is something like cycling, like a treadmill, like walking, swimming. These are aerobic exercises. These are heart-friendly exercises. Anaerobic exercises are the muscle lifting, the weight lifting, and the push-ups and the muscle building. So 99% of people in the gym, they go there to build their muscles, and 1% are actually on aerobic exercise. It should be the other way around. And the trainers, unfortunately, in the gyms are actually your nutritionists, and they give you a lot of different kinds of health drinks which might not be appropriate for your health. Now, the deaths which you mentioned are deaths of celebrities who who have died in gyms. We do not know of the deaths of people who actually are normal people who have died in gyms. That is because they are exercising inappropriately and trying to build muscle, and that causes the heart to give up. Doing aerobic exercises inside a gym has no issues at all. But gym is an expensive affair. It is more like an elitist affair. It's more like, putting it on your CV that I am a member of so and so gym. The inexpensive way of actually doing aerobic exercise is walking. And if you have space to walk, you are not in New York that or Manhattan that you cannot walk. You can walk. In Calcutta, you have a lot of spaces to walk. Chhade hato if you have to. But that is better than gym because you have a natural atmosphere. Otherwise, you are in a closed, air-conditioned space, and that is not a very ideal for exercise.
Good afternoon, doctor. Doctor, I would like to know about the mechanical first stage blockage of heart.
Mechanical?
First stage blockage of heart. Mechanical first stage blockage.
First stage
blockage of heart.
Mechanical?
Yes. Actually, my father was diagnosed with the first stage of heart blockage, and the doctor said it's mechanical. There are two types of blockage. One is electrical and one is mechanical.
Okay, all right. Okay. So electrical blockage is something because in our heart it's like a room, which's got electricity and it's got water supply. So the electricity of the heart is controlled by three fibers, like your colleague just mentioned about right bundle branch block. That is an electrical blockage. The mechanical blockage is actually the coronary blood flow. So if you have the cholesterol plaques deposited in your heart, then you have a mechanical blood flow blockage. But that can only be diagnosed with an angiogram. It cannot be diagnosed on ECG or echocardiogram.
So we have done.
So that's how they have diagnosed. So it's a mild heart blockage.
Okay,
first stage.
What are the risk factors, sir?
Risk factors I just mentioned, all the like smoking, diabetes, cholesterol, being Indian, blood pressure. These are the risk factors of heart problems.
Thank you, doctor.
Good afternoon, sir. Sir, the trend which is going on now about the intermittent fasting, that I want to know whether it is a good thing or a bad thing.
Can you do it?
Yes, I do.
You do?
Yes, I did, and I lost weight 20 kgs. But I want to know whether it is right to do or not.
No, I don't think it's right. I'm being very blunt, I have friends, very close friends of mine who are actually proponents of intermittent fasting. They do they have monetized this whole course actually of intermittent fasting. He does a lot of courses and all those things. But you lose a lot of muscle with intermittent fasting. I'll tell you the problem, what it is. While you are young, it might not be a problem. But if you are in your 40s and you do not have enough fat in your body, and if you fall sick, you don't have any reserve. Because what is going to happen is, you've lost all your fat with intermittent fasting, you've got a fantastic figure, and when you are chronically sick for a long time, maybe 15-20 days of fever, your protein, the reserve is going to go from your muscle, and you're going to lose muscle in a very bad way. And losing muscle causes a lot of reaction within your chemical reactions within your body called acidosis, and that can affect your brain, heart, kidneys, liver, everything. So it is not a good idea to do intermittent fasting for individuals unless it is a requirement for a film or even for cricketers and all. So young people, I am not a proponent of it, but if you have to have it because of your profession, that's something different. But otherwise, it can be like a Frankenstein. It is going to come back to you and eat you up when you are actually sick. When you require the fat, you have actually got rid of it by doing it yourself. So be aware of that.
Thank you, sir.
Yeah.
Sir, in your speech you said that stress is not measurable, but then how do we know that stress causes heart problems?
Yeah, it's a good question, because I think we have found out, studies have shown that people who are depressed The depression is something which has been diagnosed, and what stress causes is that you get into bad habits. Suppose you are somebody who is a very happy person, who never had any addictions, who did not have a good life. You had a good lifestyle, but now you are under stress. So the first thing you might do, if you are in this part of the world, is that you take up the cigarette. You might not want to go out, have a sedentary lifestyle. So you are inculcating all the bad things which can actually contribute to a heart problem. So stress itself may not directly affect your heart if you are young, but you can actually get into the bad habits because you are stressed and depressed, and that can cause a heart problem.
Very good afternoon, sir. I just wanted to ask that, as you said, that obesity matters on blockage of heart and it causes cardiac arrest. Then a person having hormonal problems for which they appear chubby, do they have risk of cardiac arrest? Or
Yeah, I think they do actually. Anybody who has got obesity for whatever reasons, they run a risk of a heart problem compared to somebody who is not obese. So if your BMI is say 30 compared to somebody's BMI is 25, the person with the 30 BMI has got a higher risk compared to a person of 25.
no, I mean to say that actually that person doesn't have obesity, but due to hormonal problems, he or she appeared to be chubby, means fat.
No, I think you can measure that. If your BMI is fine, you can look whatever you have to. But if your BMI is fine, it's fine. That's what it measures: your height, weight, age, and gender. So it gives you a perfect thing. So whatever the appearance, it doesn't matter. But if your BMI is fine, it is fine then.
Thank you, sir.
Good afternoon, doctor. I would like to ask that whether there are symptoms when there is a substantial plaque buildup in the heart, and if a person is under medication due to plaque buildup, is it completely reversible or the progression is stopped like up to a certain extent?
I think this is a very, very important question because plaque buildup is reversible if it is up to 40 to 50%. Then you can reverse it. But if it goes beyond that, it is very difficult to reverse that plaque medically. But there have been studies where people's blockages have been 60-70%, and they have gone very hard on exercise, diet, good lifestyle, and subsequently when they did the angiogram, it has not gone down to zero, but it has gone down to a level of maybe 30-40% without any surgical or medical intervention even. So there are studies showing that, but that will take a lot of effort to do that. And the other part of your question was that whether there are early symptoms. Early symptoms can happen if your blockages is above 70 to 80%. If your blockages is 60%, you will have no symptoms at all. And unfortunately, people who are diabetics, they will have no pain at all because their nerve endings are destroyed. The pain comes from the nerve endings. So they can have silent heart attacks. As I just mentioned, the women, they may not have heart pain at all in 43% of the population. They may have fatigue, they may have other things, but they may not have chest pain. I have also got patients who have extracted the tooth because of a jaw pain and ended up with a heart attack actually. It was not a dental problem at all. So 30 to 40% patients will have a classical chest pain. The rest 60-70% may or may not have any symptoms at all. And the blockages will only correlate with the symptoms if it is more than 70%. Below that, it will not be. Unless you do routine angiograms for everybody, which we don't, you will not be able to find out whether you have got early blockages or not.
Good afternoon, sir.
Good afternoon.
So, sir, you were talking about BMI. A few days ago, I calculated mine. It was 17.9. Is it concerning?
No, I think you can build up a little more. What's your height? You seem to be very tall.
183 centimeters.
Yeah. Are you a fast bowler?
No, sir, I don't play cricket.
You don't play cricket? My goodness, you are in India.
Yes, sir.
Okay, do you play any sports at all?
Yes, sir.
What sports?
Sir, football and
Oh, very good, very good. So I think you continue that, and I think your what do you eat?
I eat.
What do you eat?
I eat a lot, sir.
You eat a lot. So maybe you can tell me on the other side what do you eat?
Good afternoon, sir.
Yeah.
Please tell me about LVH. I have been detected with it a year ago. Why does it happen and how can I be cured or managed?
Left ventricular hypertrophy, which is LVH, is actually the thickening of the heart's muscle. That can happen if you have blood pressure problem and other variety of problems. But the usual problem is actually from the blood pressure. You can have congenital problem, like you can be born with a thick muscle heart. So, but usually it is because of high blood pressure. If you have it for a long time, you can have the heart compensates its pumping by increasing the muscle mass. So that is LVH, but it cannot be cured completely, but it can be controlled with medications.
Good afternoon, doctor. Recently, in the night, one or two nights, I had a acute chest pain along with back pain and shoulder pain. So I was taken to the hospital and they checked my BP. It was 100. The diastolic pressure was 100 and 180. And my pulse was around 98, 99. But the ECG was normal. So what can be the cause?
So are you disappointed?
No, I'm not.
Okay,
but then
good.
what caused it?
But I think I must congratulate you because I think you did all the correct steps, that you had problems, you went to a hospital. This is exactly what we want. If you stayed at home and if something happened, then that is not the correct thing. You did exactly the right things. So blood pressure, high blood pressure can cause all these problems. So if you have chronic blood pressure,
I don't have.
Okay.
I usually have lower blood pressure.
okay, so something might have stimulated one spike of blood pressure, but one spike of high blood pressure we don't treat with medicines at all. So we observe that person, and maybe after we have a method called a 24-hour ambulatory blood pressure. So that can measure your blood pressure when you are doing a normal things. So that is something which we recommend for sudden spike of blood pressure for the first time before we start initiate treatment. Because if you start medicines, this is something which we cannot stop, unfortunately.
Even a TROP-T was done.
TROP-T was they have checked you out whether you have had a heart attack or not. So you did not have a heart attack. You had a blood test done like TROP-T, which was negative. Your ECG was normal. So the reason why you had pain was probably because of high blood pressure, and the reason you have a high blood pressure, that needs to be looked into.
So one more concern. So I usually had low blood pressure, but for the past 4-5 months, my pressure is quite high. And at the same time, I'm a runner. So whenever I'm running, I'm under medication for blood pressure. But whenever I run, my blood pressure drops a lot.
How do you know that?
Because I have checked it, I have blackouts. No.
Not your watch.
No, with sphygmomanometer.
I think what you should do is that you should wear a 24-hour ambulatory blood pressure and do whatever you're doing. That will very accurately tell you exactly where you stand. Because when you're taking your blood pressure, obviously you're not running at that point of time. So you're sitting down. But whether the running is causing a drop in blood pressure, that is something which should not happen. The blood pressure should go up while you're running. So you should ideally put an ambulatory blood pressure monitor and then do your normal activities, and then we can extrapolate the readings exactly what is happening. Blood pressure is a very funny thing, it can go up, it can go down, it can be normal. So there are a lot of things can happen, but we need to find out the reason why it is happening and how it is happening, because sphygmomanometer blood pressure is an instant blood pressure, instantaneous blood pressure. But this 24-hour ambulatory blood pressure is something which we are putting it there, and there's a little patch here, and we are monitoring the 24-hour blood pressure for 24 hours, 48 hours, whatever is required. So that is something, if you are worried, you should get it. It is available everywhere now. Yeah.
Good afternoon, sir. I have a question. While answering one of the questions, you just mentioned one test, like symptoms are not visible before 70% blockage is there. So the test you mentioned, like, should usually okay, health people should go for that test? If yes, what should be the frequency, those kind of things?
See, I think asymptomatic patients, what we see for anybody, I think, it should not have to be patients. If population in general, sit down please. Population in general, I think we tell that you tick your boxes. The boxes are i.e. Sugar, pressure, cholesterol, family history, gender. If all the boxes are positive, then if you have any discomfort in your chest and which is inappropriate to the situation, then you should go to a doctor and that doctor will give you appropriate tests to be done. We have a lot of tests which can tell you whether you have early blockages or not, in the sense that you can do a treadmill test where you can find out. But I think if your boxes are all normal, none of them are ticked, which means you do not have pressure, sugar, cholesterol, no family history, young. So then I think you can ignore these kind of things. But routinely we do not do angiograms, which are actually the gold standard test for diagnosing heart blockages. We do surrogate tests like treadmill tests, like a ECG. And now resting ECG doesn't say much. A normal ECG does not say anything at all. But an abnormal ECG actually says a lot. So you can have 8-10 blockages in your heart and you do a resting ECG and it can be normal. But if you put the same patient on a treadmill, immediately will tell you that yes, the blockages are there, but that it's a qualitative test. It's not a quantifiable test. That is a qualitative test which says yes or no. For quantifying that blockage, you have to do an angiogram. Then it will tell you exactly which artery, how much blockage, what is to be done.
Sir, I also wanted to know, like, if there is no discomfort, like blood sugar and BP, these all are told to be checked yearly or 6 monthly after a certain age. Do you suggest any that kind of test?
It is impractical in a sense that you cannot do it for a whole general population. I think the least you should all do is a blood sugar and a cholesterol test. That's the starting point. Given that all your other things are normal, that you don't smoke, you don't have other problems. So if your cholesterol and blood sugar is normal, maybe 7 out of 10 cases you should be okay. But 3 can be, despite these 2 being normal, you can have a problem. But if you have the slightest problem, and if you have a very strong family history, if you're 40, I think you should go for a regular health checkup every year once. And they'll tell you exactly what things to be done. But that you cannot extrapolate to the entire population.
Thank you, sir.
Hello, sir.
Hello.
Sir, what can we do if somebody is having a heart attack and a doctor is not available?
Pray.
Other than that, what do you do?
Other than that, I think doctors will be available. It is important that you go to a hospital. If you are in a city, okay, now a lot of people talk about crushing aspirin and this and that. No, I think the best, quickly, I think you get to an emergency. Because getting your general practitioner out of his bed in the middle of the night, say 2 a.m. in the morning, getting him to come and see you without a ECG machine has very little value. Putting a stethoscope on your chest in the middle of the night having chest pain, you cannot diagnose anything, you cannot treat anything. So the best thing is call an ambulance or have your vehicle, go to the nearest emergency. Every emergency in the hospital, in not only in our city, every districts are well equipped to diagnose heart attacks. Once a diagnosis is made, then the serial treatments will start. Then you have, this is available, that is not available. But diagnosis, even a health center can diagnose a heart attack. But the patient has to reach. We do not have a 911 system where actually the ambulance reaches with a medic and a paramedic who can diagnose a heart attack at home. We do not have that. So unfortunately, we have to go to the hospital and not waste time. That Gasher antacid, that should not be. Like one of your colleagues just mentioned, she went to the hospital, it was diagnosed, it was not a heart attack, end of the story.
And if it's an emergency and while we are waiting for the ambulance to come,
You can't
there's
do
nothing
much.
we can do.
You can't do much. You can't do much because there's nothing you can do there. I mean, it is not possible to give oxygen. What will you do? You can't do anything. People who are taking aspirins and all, some people tell they chew the aspirin, but anybody who has chewed aspirin, you will understand that when you're having pain and somebody shoves aspirin in your mouth, the only thing you will spit it out. You cannot take it. It's a terrible drug. So the best thing is always ensure that a lot of people, what they do is they call their immediately house doctor, and they are helpless. And they tell you the same thing which I'm telling you, right? They will tell you to take to the hospital, and you have already lost half an hour, 45 minutes there. So don't lose time. That is very important.
Good afternoon, doctor. Just want to ask you that stenosis of valve, what causes this disease? Is there any cure, and does it pass on to the next generation?
Yeah, there are some stenosis of valves which will pass on to next generation, but some stenosis which is again common in the subcontinent, like the mitral stenosis, it is not hereditary. That is not hereditary. It is caused by an infection in the throat during a childhood, which is untreated. That can cause a valve stenosis. But some stenosis can happen when you are elderly. That is a accumulation of calcium. So different kind of stenosis of valves can happen. But usually the younger women in our Indian subcontinent, they have an infection in the throat which goes to the valve and affects the valve. That's mitral stenosis. That is very common in the Indian rural population.
How can you cure this with medication or with?
No, medication will not cure a valve stenosis because it's a mechanical problem. Because it's like your doors and windows of your house. If the hinges are broken, you will have to replace them. So valve replacement is the only way because it's a mechanical problem. Blood flow related problem, you have chemical things like drugs and everything which can work. But mechanical problems, usually if it reaches to a point where all the hinges are broken, you have to replace that door. That's how you do it.
Thank you so much, doctor.
Good afternoon, sir. I just wanted to know if a person has his pulse rate always more than 100, is it okay or is it something alarming?
100 pulse rate is not normal. It's not normal. So
always like.
So it is not a normal thing, but it can be a normal variant. But I think you need to whoever has it needs to check it out because some disease can cause your heart rate to go up.
Can you just suggest what kind of disease or?
If you are asthmatic and you take inhalers, your heart rate will be high. If you are taking inhalers 3 times a day, your heart rate could be high. If you have some thyroid problems, your heart rate can be high. Okay. So there are if it is 100 you are talking about, 100 is
more than 100.
So then you need to consult whoever.
Around 110.
Yeah. So somebody needs to consult a doctor to find out.
Does it lead to any kind of heart disease in the long run?
Yeah, it can. Yes, it can because heart is overworking all the time.
Thank you, sir.
So right, I think this has been a brilliant session. So let's not have it. If it goes on further, you get the impression that you become doctors without study, which is not a good idea. All right.
Thank you so much, Doctor, for answering those questions so patiently. And now would like to invite our headmistress, Shri Chandra ma'am, to please give the vote of thanks.
Thank you so much, sir. I think for the first time we are having something like this, a session like this, and on a topic which is, yes, this is also something surprising. It's almost 4 o'clock and you people are glued to your seats, putting up questions. Usually we don't get to see, when we do our conventional workshops and sessions. But something very important, the topic that he had talked about, very, of course, if I may say, close to our heart. And as I was saying that, he'll be touching upon the physiological aspects, but also he touched upon the emotional aspects. If I talk about stress as an important factor affecting our health, the health of the heart. So thank you so much, sir. And I think, we will look forward to more such sessions, particularly on sleep and stress for our students. I think that is going to be something good for you. And you will have plenty of questions. Thank you to you all as well. Quite late for you to stay back after school. So thank you so much for getting permission from your parents to stay back. And to all of you, my colleagues, thank you so much for being there. And of course, ma'am actually